Good evening. I'm going to call this meeting of the Standing Committee on Accountability and Oversight to order. My name is Steve Norn. I am the MLA for Nunavut and also chair of the committee. Today, members of the committee are joining us in person, by phone, and by video while they continue to physically distance to help reduce the spread of COVID-19. Today's meeting is being broadcast and live streamed. The committee will be hearing from the Honorary Carolyn Cochrane, Premier, the Honorary Julie Green, Minister of Health and Social Services, and Dr. Cameron Candola, Chief Public Health Officer, about the lifting of public health restrictions. Our first order of business is to open our meeting with a prayer. So I will ask MLA Marcellos to do the prayer, if you can. MLA Marcellos?
Thank you, Mr. Chair. May the sun bring you new energy by day, the moon softly restore you by night. May the rain wash away your worries. May the breeze blow new strength into your being. May you walk gently through the world and know its beauty all the days of your life. Amen.
Mr. Chairman Marcellos, very nice prayer. Our next item is review and adoption of the agenda. Mr. Clerk.
Thank you, Mr. Chair. So do you have a public presentation regarding changes, update on COVID-19 and changes regarding self-isolation? Following that, there is one or two in-camera matters following the broadcast that committee is asked to deal with.
Mr. Clerk, can I have a motion to approve the agenda as presented? Okay, MLA Cleveland. Okay, hearing no further changes to the agenda. I don't think I have any other changes. Any other changes, members? Hearing no changes. Can I have the motion to approve the agenda as amended? MLA Knockby. Yeah. All right. Okay, the motion is ordered. All those in favor? All those opposed? The motion is carried. Having reviewed and adopted the agenda, are there any declarations of conflict of interest? Okay, we'll go as and when. And now we'll move on to our first public matter. And with that, I'll say good evening, Premier Cochrane. Before we begin your opening remarks, I would just like to discuss how the meeting will proceed. All comments, questions, and remarks will need to be directed to the chair, and both members and witnesses will need to wait to be recognized by the chair before speaking. This process is required to allow the committee clerk to turn on and off the people's microphones. And with that, Madam Premier, the floor is yours.
Thank you, Mr. Chair. I'd like to begin by introducing the staff that are with me and the people that are with me today. So we have Dr. Cameron Candola, who's our Chief Public Health Officer. We have Minister Julie Green, who's the Minister of Health and Social Services. Mr. Russ Newdorf, who's the Associate Deputy Minister for the Secretariat. Mr. Bruce Cooper, who's the Deputy Minister of Health and Social Services. Sonia Sanders, the Director of Policy and Corporate Services for the Secretariat. And Susan Larrabee, who's the Ministerial Special Advisor for Minister Green. So, Mr. Chair and members of the committee, I want to thank you for the opportunity to speak to you this evening to discuss changes to the Government of the Northwest Territories approach for payment of isolation centre stays and updates on public health orders. COVID-19 continues to be the first priority for the Government of the Northwest Territories. We continue to review our policies and operations to ensure that they align with the Chief Public Health Officer's orders and the latest advice from the Chief Public Health Officer. This includes a recommendation to limit all non-essential travel outside of the Northwest Territories. We also continue to honour the commitment we made when creating the COVID-19 Coordinating Secretariat to improve the way that the Government of the Northwest Territories manages and pays for the COVID-19 pandemic measures and services that have been protecting our territory. Another important objective of the Secretariat was to improve communications and to ensure that we were vigilant in sharing information as well as obtaining input to inform decision-making in our response to the pandemic when possible. Over the past few weeks, the COVID Secretariat has held engagement sessions with Indigenous government leadership, community governments, and business stakeholders to seek their feedback on potential changes to isolation location and payment for isolation center stays. During these engagement sessions, participants communicated different perspectives, experiences, and ideas. I'd like to thank those individuals and organizations that took the time to participate in the engagement sessions and that provided us with written comments. This input was summarized as key themes in a What We Heard report that was released publicly on November 24th. This information was also provided to the Chief Public Health Officer to update her on perspectives across the territory, which she will consider in ongoing revisions to orders. I'd like to turn it over to Minister Green to provide opening remarks. Following Minister Green's remarks, with committee's approval, we will have an update provided on the status of the pandemic and changes to the public health orders, particularly the suspension of the Nunavut bubble and self-isolation requirements for persons sharing accommodations with travelers by the NW Chief Medical Health Officer, Dr. Cami Condola. Following Dr. Condola's update, if approved by the Chair, Russell Neudorf, the Associate Deputy Minister, will provide a presentation on the new Governments of the Northwest Territories Isolation Centre Payment Policy, which was announced earlier today and will come into effect on January 5th, 2021. Again, thank you for the opportunity to meet with committee, and with agreement of the Chair, I would like to turn it over to Minister Green. Thank you, Mr. Chair.
Message to Madam Premier. We will now hear from Minister Green. Minister Green, floor is yours.
Yeah, thank you, Mr. Chair. Thank you, Madam Premier. I'm pleased to be here with you tonight, colleagues, to talk about the change in self-isolation costs. I want to spend my presentation talking about the importance of self-isolation, particularly after traveling outside of the NWT. Following self-isolation protocols, wearing a non-medical mask and physically distancing provides the best defense against the spread of COVID-19 in the NWT. This approach is working, and we are grateful to the people who are following the guidelines and assisting us in containing the spread of COVID-19. To review what works, let's just talk about what self-isolation means. If anyone in the household has traveled outside the NWT, then everyone in that household must self-isolate. You can't go to work or school or shopping. You can use a basement suite if you have one, if it has its own entrance, bathroom, kitchen, and bedroom. There are no visits, indoors or outdoors. Getting things delivered is okay, but that contact should be extremely limited. You can go for a walk alone or with those you are self-isolating with, but you must avoid any situation that would put you within 6 feet of someone else. You can go for a drive by yourself, but you can't run any errands. If you develop symptoms, stay home. You must isolate until you've contacted a healthcare professional and you've received advice about next steps. And anytime you are traveling to your place of self-isolation, when you go for a walk or a drive, or when you are sharing common areas of your home with others, you must wear a non-medical mask. These are important steps towards keeping the virus at bay and avoiding the kinds of situations that we see across the country. To support self-isolation, we will be rolling out symptom check phone calls to self-isolators in the coming weeks. This will replace the automated email check-ins. Mr. Chair, we believe that making personal connections throughout self-isolation will encourage compliance. It will also give us an opportunity to follow up on wellness checks during the self-isolation period. We expect these changes to be rolled out in the next 2 weeks. Mr. Chair, I want to echo what the Premier has said and encourage residents to consider not traveling this holiday season unless it's an absolute necessity. Transmission rates are extremely high across the country and around the globe. The chance of getting COVID-19 has never been higher in most places across Canada than it is now. To everyone who is feeling exhausted, we understand. It has been a long year and full of sacrifices, and we know it's not easy. In these critical months, I encourage you to educate and support your constituents in following the public health measures. We need to stick together by staying apart. Through you, Mr. Chair, I'd like to turn it over to Dr. Candola, who will be providing a detailed update on the COVID situation as part of this briefing. Thank you.
Yeah, thank you, Minister Green. With that, we could now hear from Dr. Candola. Dr. Candola, the floor is yours.
Next slide. The travel restrictions and self-isolation requirements have so far been successful in preventing COVID-19 transmission in the Northwest Territories. And it's always the balance of the public health risk with the least intrusive measures to ensure the health of NWT residents. Next slide. In this slide, we talk about health system capacity and flattening the curve. In the NWT, we've been quite fortunate where we are still in containment mode, and our cases have primarily been travel related. At this point, we have a strong health system capacity. We have no active cases. Next slide. However, we do know that globally, we are still suffering from one of the worst pandemics, the second worst pandemics in our century in the past 100 years. So it's not only impacted Canada, it's impacted the entire globe. Next slide. So in Canada, the red line shows Thanksgiving when people came together with their family. And just after that, we started to see a more dramatic increase in spike in cases. You can see Canada's numbers rise as the second wave is ramping up and the risk to residents has now changed for NWT. As the holiday season approaches, this is not a time to lighten up measures, but a time for clear messaging to protect each other and celebrate safely. We know this will be a challenging season with many travelers coming into the Northwest Territories. Next slide. Cases are rising in every jurisdiction in Canada. Currently, the NWT has the lowest number of cases in Canada, with 15 lab-confirmed cases and 0 active cases. However, we know that we are heading into the winter months. More people will be indoors, weather will get colder. And so this is a scenario where we need to be forever vigilant. Next slide. If we look at Alberta today, the numbers of active cases are climbing rapidly. Currently, Alberta has close to 16,500 active cases, with about 40% in the Edmonton zone alone. There are 3 potential ICU scenarios over the next 2 weeks. At the current rate, the province could see emissions hit 120 by early December, 50 more than Alberta's current capacity. If that trend starts to level out, the projection drops to around 78 occupied beds, while the most optimistic scenario projects 45 COVID-19 patients in intensive care by early next month. Unfortunately, without new beds, doctors at the Royal Alexandra Hospital will be looking to treat intensive care patients in areas such as recovery rooms, operating theaters, or cardiac units. Next slide. So the average cost of an ICU bed in Canada is about $3,000 per day. Alberta has surpassed the original benchmark of 70 full ICU beds for COVID, with currently 96 ICU beds being used. This means that they are now crossing into a territory where they would be impacting other patients' care. This is what Dr. Dina Hinshaw, the Chief Medical Health Officer, said last Friday. Alberta may reach a critical limit where they will not be able to support their own residents or residents of the NWT who access services in Alberta. Next slide. So when you look at COVID-19, it can spread relatively quickly and it can impact the health system relatively quickly. Manitoba is a case in point. Cases in Manitoba are rising steadily, with hospitalizations sharply increasing and the number of deaths significantly increasing. The takeoff point for Manitoba had been after Thanksgiving weekend, and then you start to see a dramatic increase in deaths, ICU admissions, and hospitalizations. Next slide. So I would now like to look at recent updates in the Northwest Territories. Today, we have now updated our travel restriction and self-isolation order so that it now includes the suspension of the Nunavut bubble and the requirement for the entire household to self-isolate. Next slide. As of December 1st, we have 15 confirmed cases, which have all recovered. The most common symptoms have been fever, muscle aches, and cough. But mild symptoms are hard to detect or easily dismiss. And this is why self-isolation is so important. So far, we have been able to maintain containment, but that could be easily overwhelmed if we do not remain firm on measures while we ride out the second wave. The overall goal of all public health measures is to limit the risk of spreading COVID-19 while still allowing residents to live their lives and conduct their own risk assessments. It's always that delicate balance. Next slide. Following the outbreak in the Kibalik region of Nunavut, we made the decision to suspend the Nunavut travel bubble on November 16th. As of November 17th, all travelers coming into the Northwest Territories, including from Nunavut, must file a self-isolation plan and isolate for 14 days. This was not an easy decision to make, and it does impact travelers who had gone back and forth with Nunavut with relative ease before. But there are now cases in every jurisdiction, and we need to be vigilant through this period. Other provinces and territories have also suspended their travel bubbles due to rising cases. Next slide, please. This is the current picture of cases in Nunavut. An additional case was announced today in Arviat. This brings the total number of cases to 182, with 93 active cases in the Kibalik region. The lockdown measures implemented in every other region will be relaxed beginning tomorrow. This is a good sign, but we will still need to monitor the situation closely and continue to require self-isolation for travelers coming from every region of Nunavut. We have seen just how quickly a few cases can turn into many, even with travel restrictions and isolation requirements in place. Next slide, please. In light of record level of COVID-19 cases across Canada and evidence of household transmission, we have made changes to self-isolation guidance for travelers returning from outside the NWT. As of November 18th, all household members must self-isolate unless there is a self-contained suite separate from the living space in the house, in which an individual returning from travel can self-isolate. This means for the household, no going to school, work, visits, or running errands for 14 days. This replaces all previous guidance indicating travelers could self-isolate in the homes with others if a physical distance of at least 2 meters was maintained at all times. We do recognize that there may be at times when a traveler returns to a home of an essential worker and they need to have the ability to request a permission to work. However, they are still required to isolate outside of work and follow other stringent social distancing and masking measures while working. Next slide. We've also recently updated our symptom list and added abdominal pain, skin changes or rashes, and chills. With more symptoms, we hope to encourage more testing. Thresholds have been lowered and symptoms have been expanded for assessment and testing of COVID-19 in the Northwest Territories. Assessment and getting tested for COVID-19 is crucial to keeping NWT communities safe as the pandemic surges across Canada. When people come forward, healthcare professionals are able to identify and respond to cases in the community. They can isolate anyone who has come in contact with positive cases and therefore break the chain of transmission. Getting assessed and tested is quicker and easier than ever. The territory's turnaround times for test results have fallen to an average of about 2 days territory-wide. Next slide. We do know that this will be a challenging holiday period, and we have recommended that people should avoid non-essential travel both in and out of the Northwest Territories. But we do recognize many families wish to be together and some students need to come home, so we do anticipate there to be an increase in travel over the month of December. With a new requirement for the entire household to isolate, we hope to contain any possible COVID cases of incoming travelers. We are not anticipating any further changes to our orders at this time. We do want to make it for the holiday period and reevaluate the situation once this is passed. Next slide. So thank you for your time, and I'm ready to take questions now or after the second presentation. Thank you.
Dr. Condola. Actually, we understand that Mr. Neudorf has a short presentation as well. So, Mr. Neudorf, the line is yours.
Yeah, thank you, Mr. Chair. So you can just go to the second slide. As you're aware, isolation centers were quickly established early in the state of public health emergency to implement the Chief Public Health Officer's self-isolation and travel restriction orders. And the GNWT has been paying for all residents to use isolation centers regardless of trip purpose. The public cost of this has been significant and arguably unsustainable. The estimate provided here is based on the assumption that the per cost stay is about $4,000 on average. Next slide. The COVID Secretariat recently undertook engagement with Indigenous and community governments and business stakeholders to gather input on where isolation should occur and how it should be paid for. We had 2 sessions with Indigenous government leadership, 2 sessions with community governments through the NWT Association of Communities, and 1 session with business stakeholders organized through the Business Advisory Council. Input received regarding isolation location was provided to the Chief Public Health Officer to inform her decision makers. With respect to what we heard about payment for isolation centers, there was a broad consensus that there needed to be changes to isolation center cost coverage to better serve taxpayers. We also heard that compassionate grants needed to be considered as a way of supporting residents facing difficult situations during the pandemic. Next slide. So as a result of our review and the engagement process, a new policy will be implemented on January 5th. Our goal has been to balance the implementation requirements of the CPHO's orders with our duty of fiscal responsibility and our need to continue to provide some financial support to NWT residents who are required to use isolation centers for reasons beyond their control. And in the broadest strokes, the approach can be summarized that the GNWT will only pay for non-discretionary uses of isolation centers. Next slide. The policy defines the circumstances under which the GNWT will pay for stays at an isolation center. And there are 4 main criteria for GNWT's payment. These include medical travel, which requires use of an isolation center, medically advised self-isolation that doesn't involve travel, such as required when awaiting a test result, compassionate travel by residents, and a case-by-case category to allow us to quickly address unique or unforeseen circumstances. I would note that we do recognize that students returning in the spring are not explicitly dealt with in this policy, so we will need to further consider how best to accommodate them, and we will be updating our policy as required. Okay, next slide. For medical travel, the GNWT will pay for residents on medical travel who need to use an isolation center. This is for medically necessary health services and will need to be referred by an NWT health practitioner. It should be noted that not all medical travel will require use of an isolation center. If someone returning from a medical appointment outside the territory can self-isolate in their home in one of the 4 hubs, there is no need for them to use an isolation center. Next slide. For medically advised self-isolation, this category captures non-travel related use of isolation centers by individuals who have been advised to isolate by a doctor or public health official where self-isolation elsewhere is not possible. And examples might include individuals awaiting a COVID-19 test result or who are isolating due to contact with a confirmed positive individual but have nowhere else to self-isolate. Next slide. The policy provides for the GNWT to cover residents' stay in an isolation center resulting from compassionate travel. Compassionate travel is defined as a serious illness or a death in the family. And for the purposes of the policy, family refers to the commonly understood concept of immediate family. We will need processes around how we document these circumstances and what things like serious illness entails. And those are implementation details that the COVID Secretariat is currently finalizing. Next slide. Policy defines a 4th category for unique or unforeseen circumstances. This isn't meant to provide a general category for travelers to exploit. Instead, it provides us the room to quickly deal with exceptional situations on a case-by-case basis, which we know may arise during the quickly evolving pandemic situation. We recognize that a policy like this won't capture every possibility, and we want to be nimble. However, we're still maintaining the principle that the GNWT will only pay for uses of an isolation center when that use is non-discretionary or compassionate. Next slide. This slide contains just a few examples about when an individual or the GNWT would pay. So, for example, if you're on personal or leisure travel, that would be considered discretionary travel. If you're visiting family or vacationing or shopping, then the traveler pays. If you're a new resident traveling to the NWT, then we would expect between the traveler and the employer that there would be arrangements for self-isolation. If it's medical travel, the GNWT will pay. Or if it's medically advised self-isolation or compassionate travel, the GNWT will pay. Next slide. The new payment policy will come into effect on January 5th, right after the main travel season of the holidays. The policy was made public earlier today, along with the Chief Public Health Officer's public health orders. We believe this will provide residents with enough time to make or adjust any travel plans they may have after January 5th, if necessary. The COVID Secretariat needs to finalize some internal processes before the policy comes into effect, and we are reviewing what additional public guidance may be required. And as mentioned earlier, this includes confirming a plan for NWT students who will return to the territory in the spring of 21 after concluding their school year. And thank you, Mr. Chair. It's the end of the presentation.
Mr. Chairman, Mr. Newdorf. And with that, we'll do a round of questions, and we'll do one question and one follow-up question with each member. And we have a list that we set up prior to this meeting. And first member I have up is Emily Bonarouche. So, okay, move on down the list. Next up, I have Emily Johnson.
Thank you, Mr. Chair, and thank you for the presentation. I appreciated the slides showing kind of various presentations of what's happening across Canada and around the world. It kind of puts us in context of how lucky we are to date. I guess my question is, I have no issue with the changes to the isolation costs. I think it's kind of a step in the right direction given the savings, but I'm more curious what is not in these changes. When we went out and did our consultation, there was discussion about asymptomatic testing. There was discussion about reducing the overall isolation time from 14 days to 10 days. There's been a lot of discussion about making the same kind of exemptions we make for essential workers to people on medical travel. And so here we are after consultation, and I don't see any of those things. I don't see any additional communities beyond the hub communities changed. So I guess my question is, can we expect to see any other changes other than these ones coming out of consultation? Thank you, Mr. Chair.
Thank you, Emily Johnson. We'll go to Minister Green. Would you like to take that?
Thank you, Mr. Chair. Mr. Chair, this question should go to Dr. Candola.
Thank you, Minister Green. Dr. Candola.
Thank you, Chair. Absolutely, these are questions directed to myself. When we started looking at making changes to the travel restriction self-isolation order, because the last amendment had been July 12th, we were looking in July and August, and the number of cases, daily cases in Canada were quite low, less than several hundred. And we did anticipate a second wave occurring. However, given all the public health mitigation measures and given how successful we were in flattening the first wave, I had monitored the situation, hoping that we could maintain the same success. Unfortunately, the number of cases started to increase. We reached about 6,000 cases. We have over 12,000 deaths. Any move to relax the restrictions would not be a prudent response to the pandemic response right now. And we've seen, looking at Nunavut, just how quickly in the space of 1 or 2 weeks you can obtain community-wide spread. So looking at the situation across Canada, looking at the impact it's having on the healthcare system, ICU beds being full, doctors and nurses being burnt out, The number of cases have not peaked. We're only going into a darker, longer winter. At that point, I made a decision that relaxing restrictions need to be postponed, and we need to look at actually maintaining and tightening restrictions on travelers so we can get through the next 6 weeks. With respect to testing of targeted screening, the one success is around rapid testing. We are able to test symptomatic people and get a turnaround time of 2 days. And we have increased screening of asymptomatic high-risk essential service workers, because those are the ones that are not isolating, but are working in high-risk congregate settings. So those would be healthcare workers, RCMP officers, correctional officers, dentists, and dental assistants. So those are situations where we are screening on day 1 and day 8. At this current time, people are isolated in the 4 hubs. But if there's any exigent circumstances or if people need to be in the smaller communities, we are looking at screening that category of people as well. Thank you.
Thank you, Dr. Gondola. Follow-up, Emily Johnson.
Yeah, I guess my other area of concern is that we drafted our back to school plan way back in August, and our school systems have been dealing with that ever since. And I get that, you know, there's not a desire to relax restrictions, but I still find it slightly ridiculous we're not allowing singing in schools. The kind of stories I hear of what just children are not allowed to do in our schools, I find a little frustrating, given that it's not at all related to travel. Is there any appetite for the Chief Public Health Officer to revisit the current guidelines for our schools that were created back before the school year? Thank you, Mr. Chair.
Thank you, Emily Johnson. Dr. Gondola.
So the delicate balance is what's the right amount of restrictions, and then how open can you keep our regular schools, businesses, organizations, workplaces. What people fail to realize that across Canada, literally thousands of school outbreaks have occurred and hundreds of schools have been closed. We have been fortunate because we have mitigation measures in place that we can continue to keep our schools open. So the balance of this is that there are some low risk activities that can occur and have minimal spread. But if you were to have an asymptomatic child who has COVID, picked it up from, let's say there's a breach in isolation, and go to school and engage in higher risk activity, which involves aerosol transmission, which we know that the 6 feet distance and the suspension in the air is a lot longer. And you have a higher risk of picking it up. Then what we have is enable a super spreader event. So when we go for every mitigation measure, it may seem ridiculous, but we're looking at it from the point of COVID-19. It doesn't care if people think he's ridiculous or not, that COVID-19 knows exactly the conditions that can spread to the most amount of people. And that's exactly where I'm putting my mitigation measures and saying, no COVID virus, we're not going to enable you to spread to as many people as quickly as possible. So there are certain activities that would be considerably higher risk. Thank you.
Thank you, Dr. Gondola. Up next, I have Emily Sumler, and on deck I have Emily Jacobson. Emily Sumler.
Thank you, Mr. Chair. My question is around the authority, I guess maybe to the Premier. Last week we saw the Chief Public Health Officer for Alberta clearly state that her role was to provide recommendations based on scientific evidence, but not to make the decisions on how their province manages COVID-19. That's the role of the elected officials. But yet here in the Northwest Territories, we've heard the opposite. And that could be clarified for me? Thank you.
Thank you, Emily Sumler. Dr. Gondola?
Myself.
Madam Premier.
Thank you, Mr. Chair. So we did a
You mute it.
No, it's on. Can you hear me, Mr. Chair?
Yes, I can. Go ahead.
Okay, thank you. So we did a jurisdictional scan about to check out the authorities of the chief public health officers across Canada. There are 3 jurisdictions that are fairly similar to the Northwest Territories: Newfoundland, Nova Scotia, and Nunavut. The other ones do have a different protocol. Most of them are going through the Executive Council, etc. So right now, current in our legislation under the Public Health Act, once we declare a public health emergency, the Chief Public Health Officer does have the authority to be able to make directions and orders, and within that, it's pretty clear that she, or in this case, she, should have no political influence on her decision making. That is to make sure that the residents are safe. So what I can say is, though, that when these public health orders, or the Public Health Act was made, and we delegated things like the Emergency Measures Act to Municipal and Community Affairs, we were dealing with issues such as forest fires in Public Health Act, things like tuberculosis, whooping cough, etc. We never expected a pandemic. So we all know, I think that all of us around the table know that once the second wave, or once we've been vaccinated for COVID-19 and the health risk is lower, at that point we need to look at all of our pandemic services. The authority of the Chief Public Health Officer, the delegations under Municipal and Community Affairs, our responses, everything has to be on the table, and we need to update our own legislation to make sure that it meets the needs of the residents of the Northwest Territories. Although in saying that, I do have to say that I do believe that sometimes political influence has to be something that's really looked at. I know the comment was made that we're very lucky we don't have COVID-19 in the Northwest Territories. I beg to differ and say it's more than just luck. It's because of the actions of Dr. Candola, because of the actions of residents who have abided by the recommendations and the orders, and because of residents that have called in to protect NWT and 911 to report. Thank you, Mr. Chair.
Thank you, Madam Premier. Follow-up, Emily Summer.
And thank you for that, Madam Premier, or Mr. Chair. So, and I'm, in some sense, I'm glad because, yeah, we probably are doing the best in the country right now. So, without political influence, I guess it's working. I guess just a follow-up to that, there are other decisions that are being made, and I'm just wondering, because I don't see, for instance, in my region, right now, today, the Dempster, when springtime, when the ferries, or when it was breakup, the Dempster Highway kind of closed. Hunters were allowed to go up if they can get up there, but the road was closed. So that was kind of to save some money within, I guess, not having to have people man the highway since the crossings were not open. But now that we know that today the Department of Infrastructure said that lightweight vehicles can travel across, the Mackenzie. So is that a infrastructure decision to open up the highway again? Or is it a COVID secretariat? Or is it the Chief Public Health Officer? Who's responsible for that highway to open up again? Thank you.
Thank you, Emily Summer. Madam Premier.
Thank you, Mr. Chair. That's quite a technical question. If appropriate by the Chair, I'd like Russell Nudoff to address this question. Thank you, Mr. Chair.
Yeah. Thank you, Madam Premier. Mr. Nudoff, the line is yours.
Thank you, Mr. Chair. The decision to open or close a highway rests with the minister responsible, so it's the Minister of Infrastructure in this case. We, within the COVID Secretariat, and particularly with our border check stop that we have in place, would have ongoing discussions with infrastructure officials just to make sure that we're coordinating our activities with, the opening and closing of the highway. And in what happened this last, during freeze-up, was that, as soon as they opened the highway, we were able to have our check stops in place so that we could be there monitoring the traffic as it entered and exited the territory. Thanks.
Thank you, Mr. Rudolph. Up next, I have Emily Jacobson, and then followed by Emily Simpson. Emily Jacobson, line's yours.
Thank you, Mr. Chair. Good evening, everybody. I just have a question for the. I was reading the cost of leisure travel that would be not covered by our government no more, but I don't see anything. I know Russ brought it up this evening about the students coming back from school in the spring, and I think that we should be covering that. I'm just wondering why aren't we covering that, and why isn't it in black and white that we're covering the travel for the students coming back in the spring? Thank you.
Thank you, Emily Jacobson. Madam Premier.
Thank you, Mr. Chair. Currently, the residents or students that might be returning over the Christmas season are covered because our new orders take place January 5th. And that was the purpose. That date was picked by Cabinet because we had made the determination that most people would have been back by that time for the Christmas season, including students, including people that have children in school that might have to get back to school, etc. There will be a few that fall through. We will be looking at students returning in the spring and returning at any time. So right now they'll be covered, and you will see probably in February that we will be addressing the need for students and how we will take care of them. Students are our residents, and we respect that. So we will, it is a conversation that will be at the Cabinet table, and in February we'll be bringing that forward. Thank you, Mr. Chair.
Thank you, Madam Premier. Follow up, Emily Jacobson.
Yeah, thank you, Mr. Chair. No, that being said, in regards to, I brought this up in last days of sitting. Where are we at now with the rapid testing on medical travel, and why aren't they putting medical travel rapid testing in place to shorten the stays for medical travelers coming from the south? In regards to rapid testing, if we have the unit sitting in Nunavut, why isn't it being used? Thank you, Mr. Chair.
Thank you, Emily Jacobson. It sounds like a question for Dr. Condola. Would you like to take that, Dr. Condola? Thank you.
Sorry, I was on mute. So right now, we provide testing for everyone who is symptomatic, and then there are essential workers who have to work right away that are high risk, that are work with very vulnerable populations, such as healthcare workers, correction officers, RCMP, and dentists. One of the confusion or clarification that's required is that even if someone got tested, people feel that that means that they don't have to isolate for 14 days, and they do have to isolate for 14 days. If you came in on day one and you had a negative test, it doesn't shorten the amount of days that you isolate. We do know that med travel patients are like, it was the number one reason for essential travel, especially into Alberta. But right now, there's over a dozen hospital outbreaks occurring across Alberta, at least a dozen. The hospitals are filled to capacity, and so the risk of acquiring COVID-19 when you're in Alberta, given the number of active cases, has never been higher. At the same time, it's typically the medical traveler, if they're extremely complex and vulnerable, at the highest risk for severity. And so we like to have our med travel patients not go directly into the community, but to stay as close as possible in one of the 4 hubs where we have stronger healthcare provisions, such as Nunavut, Fort Smith, Hay River, Yellowknife. However, there has been exigent circumstances where I've allowed med travelers to isolate in their community, but that would require community notification, the ability to safely isolate. And in those scenarios, I have recommended a test just to make sure they don't have COVID before they go in, but it was no means to shorten the isolation period. And these are case-by-case exigent circumstances. Thank you.
Thank you, Dr. Condola. So up next, I have MLA Simpson, and up next after that is Emily Knuckleby. So MLA Simpson, line is yours.
Thank you, Mr. Chair. I guess the question I have is, we've tightened the restrictions for residents of the NWT, making all the people in the household self-isolate. I'm wondering what changes have we made for those who are deemed essential workers that have access to our communities on a daily basis, going into stores and things like that. So I'm just wondering if we did anything to tighten up for essential workers, or did we just do it for our residents? Thank you, Mr. Chair.
Thank you, Emily Simpson. That would be a question. I'll put that for Dr. Condola.
Thank you for that question. So when you look at what's where we are in NWT, we are in an extremely fortunate position where we're in relative containment. What that means is we have no evidence of community transmission as of today. And so our main cases have been travel related. And so the tightening up of restrictions have been for not only for resident travelers or people who are isolating in their residence, we've also tightened it up for essential workers. So with essential workers, all the workers have to be reviewed for exemption by myself. We're actually refusing more essential workers from starting on day one, requiring that they do 14-day self-isolation. Just based on what is happening right now, a lot of hotspots across Canada. So we're evaluating each worker request to be exempted from isolation very carefully. High-risk essential service workers, we require that they test on day 1 and day 8. We're requiring that all essential workers mask continuously in indoor public spaces and then outdoor if they can't physically distance. We put in more stringent requirements on that food has to be delivered, that they cannot be going into stores, and that they need to isolate off shift. So this is all written in a letter and given to each worker. And so if there are any breaches to that, if essential workers are going into stores or not wearing masks or not isolating off shift, then that needs to be submitted as a complaint so we can investigate. Thank you.
Thank you, Dr. Condola. Follow up, Emily Simpson.
Thank you, Mr. Chair. I guess just on that note, I guess one of the issues that come up quite frequently in Hay River, and I think this, partly because we're so close to the border and we have a lot of people coming and going, is enforcement. Because as we're tightening up the restrictions, what are we doing to tighten up enforcement? Because in Hay River, we had some people in today, and we were having that discussion, some government people, and there seems to be, the enforcement still seems to be lax in the community, and people are still confused as to who's actually doing enforcement, and how many do we actually have enforcement people here, and so on. So I'm just wondering, are we looking at also beefing up the enforcement to ensure that these new and tighter restrictions are followed? Thank you, Mr. Chair.
Yeah. Thank you, Emily Simpson. Madam Premier, would you like to take that?
Yeah. Thank you, Mr. Chair. Absolutely. Enforcement is part of the puzzle that we need to make sure that is working well. What I do need to tell residents, there's two things. One is I think that we need to do a better job of communicating what the requirements for essential workers are so that people in the public know. Because I have heard differences, people saying, oh, they're allowed in the restaurant because they got an exemption. But I think we need to do a communication. We will be doing that for sure. We'll be pumping that up. The other thing is that we don't have enough workers to be able to have a check on every single person. So Minister Green talked in her statement about we will be doing phone calls to people that are in isolation centres. But when it comes to essential workers, there's two pieces. We recommend that, or we order every single essential worker abide by the orders or their exemptions they've gotten. But if there's community members that are seeing people in the restaurants, in the grocery stores, etc., that are essential workers and they're not wearing masks or they're just hanging around there, please report it to the Protect NWT or 811. There's privacy concerns, so I know that people often feel that we don't look into them because we don't get back to them. But we're not going to get back to you. But you have to rest assured that every single case that has been referred to Protect NWT or 811 is investigated. A lot of them, in honesty, are closed on the initial phone calls. We understand, we know what's going on. And if we don't, we go in and actually physically investigate every single one. And we do provide a variety, either a written warning, a verbal warning, or when situations are serious, we do fine people. So again, two things I need from residents. One, please abide by the recommendations and the orders. We're in this together and all of us need to protect each other. And two, if you see essential workers in the public that are not wearing masks, that should not be there, please report them and we will investigate. Thank you, Mr. Chair.
Thank you, Madam Premier. Up next, I have Emily Knockleby, followed by Emily Marcellos. Emily Knockleby, that's yours.
Thank you, Mr. Chair. Mr. Chair, my question is around the selection of the January 5th date. I do recognize the students would want to come back for Christmas and others, but I actually feel like this may encourage people to get one last run out of the territory back into southern provinces when they can still get paid or have the isolation covered when they return to the territory. So maybe you could explain a little bit why that decision was made not to actually have the changes made immediately versus later. I think there's going to be a whole bunch of people that will go, and that's going to cost us a lot of money over Christmas. Maybe perhaps the students could have been made an exemption if that was the reasoning for it. And then further to that, if this is the second wave is coming, I do see we got an email today about a lot of ministerial travel. Is the GNWT going to be stopping non-essential travel? Thank you.
Thank you, Emily Knockleby. I'll leave that one with Madam Premier.
Thank you, Mr. Chair. Just had to write down the second question. The January 5th date was picked by Cabinet because we recognize that people need notice. It would not be fair to come out today and say that we're stopping them immediately. In our opinion, as a Cabinet, as the Executive Council, we decided that people have already made plans. People have made plans to go visit their families or bring their students, etc., up to the territories. So it was a decision that was made because we felt that the public deserved to have notice. Therefore, we're giving them the notice. And we also recognize that arrangements had been made already. So that was why January 5th was picked. By that time, students should be going back to school. Residents, the majority, should be returning back to the territories. So we recognize that people will be doing some leisure travel. We're not recommending it, highly not recommending it. But for those that are, then we still need to make sure that when they come back to the territories that we keep all residents safe. As for the non-essential travel, absolutely. So no ministers are actually traveling out of the jurisdiction unless there's an emergency or they're on their own. No minister is traveling down south. We are still traveling within the Northwest Territories. We are trying to do as many remote visits as possible. But in honesty, I mean, every time we have a lot of bilaterals coming up with our Indigenous governments, and I've given them the options. So I've told them two things. I said we prefer to do it remotely. It is the safest for all of us. Those that are insisting on doing them face-to-face, and we do have some that are insisting, I've been very clear in telling them that if we have any type of community outbreak, those visits are automatically stopping and we will not be traveling throughout the territories. But right at this point, travel within the territories is still allowed. Thank you, Mr. Chair.
Thank you, Madam Premier. Follow-up, Emily Nakaway.
It's more of a, just more of a comment. When I see that it's to go to an opening in Fort Providence, which is, deemed one of these communities that is, critical or, sensitive, I think that those types of visits should be rethought. If you are so concerned about things coming in, we do have a lot of essential workers coming in and out of the south. We have people on planes that then go through to Nunavut that are southern workers that are with residents that are then continuing on. So to me then would make sense to then also limit our movements within the territories, in particular to small communities. Thanks, more of a comment.
Thank you, Emily Nakaway. We'll take that as a comment. Up next, I have Emily Marcellus, followed by Emily O'Reilly. Emily Marcellus, the line is yours.
Thank you, Mr. Chair. I don't have very many questions. I don't have any questions, really. I'm, with this 14-day isolation that I'm doing now, I've done 65 days in all since March. So it's a lot of time, but you know what? If we're going to keep the community safe and the territory safe, I don't have a problem with that. And I'm very pleased with the new regulations isolation because I think it was out of control. Enforcement is okay in Fort Smith because we're a very small community, and I don't think I think that the community enforcement here is doing the best job possible. And the only concern I have, of course, is essential workers. We've got to make sure that they abide by the rules. I think that we have to make sure they do, and maybe we can just convey that to our enforcement people because it's really important that we keep the community safe and the territory safe. And when we voted for the COVID-19 Secretariat, there was a lot of discussion, and I think seeing by the numbers now and seeing that we're clear now in Fort Smith with that one isolation thing that had to happen in the last month or so, and the 5 cases, I'm very pleased with the way things have been happening. And with that, I'm not going to have any questions for you, Madam Premier, and I want to convey my thank you to you and Cabinet for doing the right thing with all of my colleagues on this side. Thank you. Thank you, Mr. Chair. I don't have no questions.
Thank you, Emily Marcellus. We'll take that as a comment. Up next, I have Emily O'Reilly. The line is yours.
Thanks, Mr. Chair. One question about, I'd like to know, with this change in the self-isolation policy, center policy, what the projections are in terms of cost savings from January 5th until the end of the fiscal year. Thanks, Mr. Chair.
Thank you, Emily O'Reilly. Madam Premier, would you like to take that?
Thank you, Mr. Chair. So, guesstimate, in fairness, that we're anticipating that about half of the self-isolation costs are due to leisure travel. So we are expecting that that between the January 5th to the end of the fiscal year, that we will be able to go down to about half of what we were projecting for that time period. Of course, noting that over the Christmas, there will be people coming in. So that is the goal. But at the end of January, actually, once we promised that committee that we provide monthly variance reports. Within those variance reports, we'll show the savings as we go forward. Thank you, Mr. Chair.
Thank you, Madam Premier. Follow up, Emily O'Reilly.
Thanks, Mr. Chair. I'm going to squeeze one in, and then I have one other if I can. Can the Premier give me a dollar figure for that amount? And secondly, though, my question really is the news reports coming out of Alberta are really quite alarming, to say the least. The people in the health field say that the health system in Edmonton and Alberta is under significant strain, and if this continues, it's going to collapse, quite frankly. So, at what point do we stop sending people to Alberta for testing, for whatever? And I think we need to recognize that this is a real possibility, and it's going to happen in literally weeks because Alberta is not doing what they should be doing. So when do we stop sending people to Alberta? But if I can get the Premier to give me the cost figure as well. Thanks, Mr. Chair.
Okay. Sounds like there's a two-pronged question here, so I'll start with Minister Green and maybe hand off to Madam Premier. Minister Green, would you like to start?
Yeah, thank you for the question. And of course, we're aware that the hospital situation in Alberta is consistently strained. Our staff is regularly in touch with the authorities at Alberta Health Services. There has been no change in the service level for NWT residents at this time. I know that people have been deciding not to go to Edmonton for routine medical appointments because they're concerned about the outbreak there, but the service continues to be provided at the same rate that it was previously, and if there's a change to that, that will be well publicized. And the Premier tells me the savings on the isolation centre is approximately $1 million for the period you named there, January 5th to March 31st.
1 million a month.
Per month, 1 million.
$1 million a month. Sorry. Why am I answering the question?
Excuse me. Thank you, Minister Green. One quick follow-up, Emily Riley. Was that your follow-up? We're good?
Yep.
Okay, just want to make sure.
Yep.
Okay, up next I have Emily Cleveland.
Thank you very much, Mr. Chair, and good evening. My first question is in regards to timely and consistent support from Protect NWT. For people to be able to adhere to the self-isolation policies, they need to be able to create self-isolation plans. And probably the most consistent thing I hear from constituents over and over again are three things to do with Protect NWT. The first is the time to reach Protect NWT. I'm still hearing about multiple constituents who are on the phone for 1 to 2 hours to be able to get somebody else on the phone. The second is inconsistent information each time that they call in. And the third is being told that self-isolation plans will not be approved until 3 days prior to travel. And I've had multiple constituents be told that it's very costly to book travel at the last minute, and both for individuals and for businesses, it's very unrealistic for people to be able to efficiently plan as well. And so I guess my question for that is, what support does Protect NWT need to better serve clients, NWT residents, so that they can create self-isolation plans in a timely and consistent manner? Thank you.
Thank you, Emily Cleveland. Madam Premier, would you like to take that?
Thank you, Mr. Chair. If Russell Nunavut could take that question. Thank you, Mr. Chair.
Thank you, Madam Premier. Mr. Nunavut, line's yours.
Thank you, Chair. We appreciate the question, and one of the things that the COVID Secretariat wanted to do was to look for efficiencies in our operation and provide more consistency in the information that we're providing, and to ensure that we've got good processes in place so that we can be as efficient and effective as possible when we are operating our call centers. So we have done quite a few things to try to achieve that to date. We have our hiring is we're about 95% hired. We've recently introduced some call center technology and we've combined the 811 and Protect NWT so that it's one system now. You can still get all the services that were there available before, but it's only all available in one system. And we actually have new call center technology in place for the actual manning of and handling of the phone calls. And we do track the length of time that people are waiting on hold. And I've heard some people waiting up to an hour. I have not heard about people needing to wait 1 to 2 hours. So we can look at the stats there and check that information. And in terms of inconsistent information, we talked about that we have are working on our processes and the documentation around that so that we can provide clear information and make sure that we're being consistent in that information. So we are documenting all of that and writing up the appropriate messages to deliver when people call with certain questions. And then finally, not improved until 3 days. That is something very recently that we've done. Is we are now triaging the Protect NWT self-isolation plans different, so that we are, if there's anything urgent that needs to be responded to in the short term, we will provide that. So, for example, somebody arriving and needing to get a SIP filed within 24 hours, and that's the first priority. And then the second, after that, we will do it on a first come, first served basis. So if somebody, files 2 months in advance, they will get their response, based on the current stats and the backlog within a week that they will have their call with this new process that we've recently put in place for responding to self-isolation plans. Thanks.
Thank you, Mr. Dordorf. Follow-up, Emily Cleveland.
Thank you very much, Mr. Chair. Just in response to that, in regards to the policy that self-isolation plans won't be approved until 3 days before, I've heard that from multiple constituents, some of which were trying to book their self-isolation plans weeks in advance, and in one case 2 months in advance, and we're still told that. And so that might be an opportunity to review a policy with Protect NWT staff. But my second question is for the CPHO in regards to our Nunavut travel bubble. Right now, the cases within Nunavut are centered towards the eastern Arctic, and although there is an invisible border between ourselves and Nunavut, the Kitikmeot region is served both in supply chain and medical travel by the Yellowknife region and not by Iqaluit. And so I'm wondering if the CPHO has entered into discussions or explored the idea of keeping the Kitikmeot within our travel bubble, both for supply chain and for medical travel reasons. Because if somebody is, say, medevaced from Cambridge Bay, they're not going to be sent all the way to Iqaluit for services. They're going to be sent to Yellowknife. And for example, with Canadian North, our Canadian North pilots are traveling up to the Kitikmeot on a daily basis in order to keep, for example, the food supply chain going. And so I'm wondering if that's being explored. Thank you.
Thank you, Emily Cleveland. Dr. Condola, would you like to take that?
So the flight crew have a specific exemption order, MLA Cleveland, whether they're going to Nunavut or whether they're traveling down south, we have a specific exemption for flight crew or supply chain or resident workers. So one of the things, NWT suspended their bubble with Nunavut, Yukon suspended their bubble with us in BC, and then the Atlantic bubble just collapsed. The thinking and reasoning behind that is it's not right now that the cases are in the Kibalik region, is what were the enabling conditions that led for a case in Arvia to be undetected for weeks and then led to community-wide transmission. Those underlying factors are still there, whether it's on the Kitikmeot or the Kibalik. So, for instance, in Nunavut, they do their isolation in highly in areas that have higher rates of COVID, so they're more highly endemic. And Nunavut, like NWT, also have essential workers from high-risk areas isolating or working directly in Nunavut. So when you look at the increasing number of daily cases, 6,000 per day, and with specific to Nunavut, that their travelers are isolating in Edmonton or Winnipeg and then traveling within Nunavut. And when you look at essential workers coming from highly endemic areas working directly in Nunavut, the risk is going to be still be there. The enabling conditions that led to the Kibalik outbreaks would lead to the Kitikmeot. And at this point, I'm looking for is a decrease in the trend of importation risk before I make a decision to recontinue the bubble.
Thank you, Dr. Garola. And I'm just going to the list. It looks like I'm up next. And just while we were sitting here meeting, I did get a question from one of my constituents that live in Detta. And they were told that if they ever did go down to south of the border and return, they would have to self-isolate in Yellowknife at their own expense. And I guess my question, and whoever wants to take, is why can't this resident in Detta self-isolate their own home, with seeing that it is in relatively close proximity to our hospital here? Thank you. Maybe Dr. Cadola?
So, but if the for Detta and Ndilo, where it's within Yellowknife, if they are requesting to self-isolate, and if they can send that request to cpho@gov.nt.ca if they've gone for protected DBT, because if they can safely isolate in Detta and they're proximal to the hospital services of Yellowknife, that could be easily considered. Similar in considering like Enterprise or the KFN Reserve, if they're close to Hay River, it's considered almost one unit. So those decisions are a lot easier than to say, for instance, whether someone in Fort Res could safely isolate in Fort Res. The 4 hub centers, Hay River, Yellowknife, Nunavut, and Fort Smith, of those, Hay River and Yellowknife have communities that are relatively short distance of health services. So that would be easily entertained.
Okay, thank you, Dr. Condola. My other question here, I don't think any of my colleagues really touched on this, was the vaccine. There was a recent announcement of a vaccine, and that Minister Vandal recently announced that Northerns are going to be a high priority. I just want to see if what does that really mean in terms of what kind of discussions have you had with the federal government in terms of distribution of a vaccine, and how would the logistics of that look for Northerners? Madam Premier, maybe I could take that.
Thank you, Mr. Chair. I think that would be, if the chair is allowed, Minister Green would address that question.
Yeah, of course. Minister Green, go ahead.
Yeah, thank you. There have been discussions at the federal, provincial, territorial table about in what order people will be vaccinated. And there is an agreement that people who are most vulnerable or most at risk because they work on the front lines will be vaccinated first. That's guidance, so each jurisdiction will firm that up into a plan. It's my understanding that the GNWT has been asking for enough vaccine for half the population. So there is no agreement yet on how much vaccine we will get or when. That is not information that the federal government has or has shared with us. But I will tell you that once the vaccine is available, we have a very efficient way of distributing it. We did almost 12,000 flu shots in 6 weeks in the Northwest Territories. So I feel that our capacity is very good for delivering the vaccine when it's available. And we've also received assurance that the military will help us if called on to deliver the vaccines. So as far as the vaccine goes, I know the big questions are unknown because the federal government is doing the procurement. But once we have the vaccine, we should be able to distribute it very quickly. Thank you.
Okay, thank you. Minister Green. With that, looks like we've come to the end of the public portion of the meeting. I want to thank Madam Premier, Minister Green, Mr. Rudolph, and Dr. Condola for your time and presentation. And for those who are tuning in, Masicho for reviewing. And with that, is there a motion to go in camera? Emily Cleveland. Yeah. Yeah, and with that, we'll take a short break.
And members who are joining by phone, if you could please stay on the line.